People still coming through. So I think it is now 1 o'clock, so we'll make a start, and I'll keep letting people in as they come. So thanks so much for joining this session with Long COVID Kids and Danilo Buonsenso today. We are recording the session, so if you'd like to keep your camera off, please feel free to do so. There are so many questions that have been shared that we want to give the opportunity to families and children who couldn't make it today to be able to watch back the recording. And for everyone who sent a question in advance, thank you so much. We were overwhelmed with the number of questions that we've received, and they're all so brilliant. We're going to get through as many as we possibly can today, and then we'll let you know about future opportunities at the end of the session. So I'm just going to keep letting people in, and then we'll move into the questions. Danilo, can I ask you to introduce yourself?
Yes, sure. So hi, everyone. I'm Danilo Buonsenso. I am a pediatrician from a university hospital in Rome. So I am a pediatrician first. I like to remind this point because I'm not a long COVID specialist. So I'm a pediatrician, meaning that I specialized in child care, and I'm seeing children not only with infections and post-infectious conditions, but even with the common pediatric issues. As I work in the emergency department, I don't know if any of you went to your pediatrician or the hospital for, I don't know, abdominal pain, for the trauma, head trauma. So my job is to see children in general. During these years, I specialized myself in pediatric infections, and this is how I started seeing patients with acute infections, including COVID. And since my boss was expert in following up some children with specific infections, I kept going, following up children with infections and with COVID. And this is how we discovered that long COVID is an actual real disease as every other disease. So I'm super happy to discuss the topic with you. I've seen some of the many questions, and actually let me kind of do a disclaimer. Some of the questions are very difficult, and I think this discussion actually may also benefit other colleagues, or maybe Sammy, you will need to think to send the video to the World Health Organization, the long COVID group, because the questions are really technical, not like this looks to me as a real scientific session, and I will manage this session as a scientific meeting, of course, discussing in a hopefully understandable way. Sorry, my English is not perfect. I have my strong Italian accent, but that's it. And I cannot do anything on that.
You're doing a great job, Danilo. Thank you. So just for the benefit of those who've just joined, we are recording the session today. If you'd like to keep your camera off, please do. If you'd like your camera on, that's fine too. I'm going to start asking some of the questions that have been sent in advance. We've had probably more questions than we will be able to get through today, but we're going to do our very best. So I'm going to start with a question from Clara. Why do I get tired all the time?
Okay, so the tiredness is, in my experience, the key symptom in long COVID. And despite we don't know exactly everything about this disease, we now clearly know that multiple systems are involved in patients with long COVID, meaning that there is a chronic activation of the immune system. And this is like when you have a fever, you feel more tired than usual because your body, your immune cells are fighting against something, and they kind of use your energy. Another reason is that we now know very well that some patients develop postural orthostatic tachycardia syndrome. This is a condition when the heart goes too fast. I'm sure that many of you feel your heart beating sometimes too fast with even with very small movements. So when your heart beats too fast or too many times a day, first of all, the heart is a muscle, and it consumes energy because to work, it needs energy, so it kind of uses too much energy from your body. But also when the heart pushes too much and too fast, it doesn't push the blood very well everywhere in the body, including in your brain. And this makes your body feeling more exhausted, but also having a headache because the blood flow is not optimal. But also we know that there is an impairment in the muscles, and in particular with the mitochondria, which are like a laboratory in the cells that are involved in producing the energy from the oxygen. So these, at least these 3 or 4 events I've mentioned are clearly demonstrated in the literature, even in patients suffering with fatigue syndromes from other viruses. And this is why you get tired. You are usually always tired, but with minimal effort, you get even more tired.
Perfect. Thank you. Hope that answers your question, Clara. So we've got a question from L, age 15. How can you stop post-exertional malaise? Because that's the worst thing. You can push through tiredness, but not this.
Yeah, so nowadays we don't know yet how. So today, if I have to provide an answer today, how to stop post-exertional malaise, the only way is to prevent it. And because we don't have yet a treatment specific for post-exertional malaise. This means that you should, as long as you live with this condition, you should learn you can maybe make a diary, daily diary, and you can learn what are the activities that triggers you post-exertional malaise, and therefore you can try to adapt your activities in like stopping before you reach that level of activity. I mean, let's say if you are 2 hours in school, in class, and this is okay for you, you can go with the 2 hours. But if you know that staying 3 or 4 hours in your class, this triggers post-exertional malaise, the ideal will be to have an agreement with your school to have 2 hours of lessons in class and the rest at home to prevent post-exertional malaise. Unless, so this is in general how you can prevent post-exertional malaise. Unless we are now studying more and more medications, and hopefully these medications will make you feel better in general, and therefore will make you have less post-exertional malaise, or at least with more exercises than before.
Thank you. We have a question from Phoebe. Sorry, from Erin. Is there anything I can do or take for the pain in my legs? Anything to help my brain fog?
Okay, so no, I think the brain fog and the pains within the among the body may be 2 different things. In my experience, it's easier to manage pains in your bodies, in your legs, rather than brain fog. So I would say that there are some medications that can help with the pain, and I will start with this point. We have a very good experience with 2 levels of medications. One is called PEA, P-E-A. It's the short word for this long word. And PEA is a neurotransmitter, a neuro compound, which is physiologically produced by the organism, which has anti-inflammatory properties on the central nervous systems and on the peripheral nerves. When patients do not improve with that, in our center, we use a lot of medication, which is called gabapentin, which is used for several diseases which have a neurological pain, like diabetes, pain associated with herpes zoster, or pain associated with type 2 diabetes or other neuropathies. And this medication has several broad effects, works very well with pains and chronic headaches, which if you don't treat, make your day worse and worse, and in turn to exacerbate also other problems like the fatigue, the threshold to to arrive to post-exertional malaise. So to summarize my response, yes, those two medications are those that I always use for pains. For brain fog, it's more difficult. I have to say, brain fog is nowadays the most difficult symptom to control in my experience.
Thank you, Danilo. So there's a question from Pascal. Do we know if it's possible to get completely cured from the disease, not just much better, which is already great?
Yeah, that is another great point. So it depends, as every diseases, like even for pneumonia, let's say when you have a cough or you have a fever or you have a flu, even before you got COVID. So there are some patients that have a mild form of the flu and they can recover, and some patients who have a very severe form of the flu and need a lot of time to recover. We now know that even in the long COVID, we have a spectrum of severity, and those with a mild, moderate impact, first of all, can be much better. In my experience, many patients, like 80% of patients, can at least improve during their daily life, meaning that they can return to attend school, go out with friends, maybe doing some minimal activities. And in some cases, I have succeeded to eventually, after a few years, to stop medications and they were still keeping fine. In some other patients who are those with the most severe disease, meaning extreme daily fatigue since years, complete inability to go to school or to do activities, or in these cases, I don't want to already provide false expectations. So I would say we have chances to get better. We don't know yet because this is a disease we know since 4 years, more or less. We cannot be sure yet that nowadays we have a cure, but hopefully I am confident that in the next years we will. So in the most severe cases, I would say don't lose your hopes, and because we can get better, but I don't want to give the false promises that you can for sure completely be cured from the condition in the short term, but we will in the longer term.
Thank you, Danilo. That's really helpful to hear that there's great hope in that message. And there's a question from Meredith. Why does long COVID affect people in different ways?
This actually seems something unusual, maybe for people having long COVID. But if we think at medicine in general, every single disease shows up in a different way in a different patient. Again, a very common disease, the flu. If you have 100 patients with the flu, 100 patients have different diseases, like the one having just some cough, the one having pneumonia, the one having encephalitis. This happens in every single disease, and it depends on how our organism and our genetic background interact with a stressful situation. The stress can be any trigger, like physical, emotional, or microbiological. So the reason is that each of us is a different person from a genetical perspective, and the way our immune system, our cells, our body react to a physical, microbiological, or psychological stress is different each other. And therefore, this is why some people have mostly fatigue, some people develop post-COVID myocarditis, some people develop post-COVID type 1 diabetes, some people develop a long COVID characterized by brain fog mostly, and others who are very well from a cognitive perspective, but suffer extreme fatigue or tachycardia. This is the reason, because our body interacts differently. We don't know the roots of every single pathways in our body.
Thank you. So there's a question I'm going to take from the chat now, from Kadeen. I hope I've pronounced that correctly. I was almost better from long COVID, but got a reinfection and my long COVID became worse than ever. How come reinfections are so bad for us?
Yes, this is unfortunately a very common scenario. I think each of us, the few doctors dealing with long COVID nowadays, know very well that patients with long COVID have a very high probability of getting worse after having a new COVID infection. So basically, the reason is that if you develop long COVID the first time or once when you got COVID, means that for some still unknown reasons, you have a genetic predisposition to have a particular reaction when you meet some specific viruses. And this means that you have a kind of a predisposition of developing chronic inflammation, or you are not very much able to clear the infection in the short time. Therefore, it comes not as a surprise if you have a particular sensitivity to that virus, that once you meet again the virus, your general well-being gets worse. And honestly, this is why I always suggest to treat reinfections with COVID reinfections when a patient with long COVID meet COVID again, because there is clear, so these patients who develop chronic fatigue, long COVID, after viruses in general, have some genetic predisposition to overreact to some specific viruses. And so once you know that COVID is one of those viruses that you are not able to clear, you are not able to switch off your inflammatory responses, you have the risk, there is a risk that every time you meet the virus, you worsen. And in my opinion, this is extremely important to consider an antiviral treatment during the infections. I now suggest every time to my patients. And this is difficult, but trying to avoid infections like having, for example, air filters in your class, or when you attend very close and busy environments, I will consider wearing a mask.
Thank you, Danilo. Really good, helpful points there. There's a question from Karen. How do I approach the question of mental health issues? They developed at exactly the same time as my long COVID, without my doctor automatically concluding all of the illnesses in my head.
Yeah, so unfortunately, I totally understand, because this is a fight I also have to deal with every day with my colleagues. So basically, you can tackle it in a very concrete way. First of all, you should have a doctor. So nowadays, we know very well that long COVID has clearly been linked with several objective abnormalities, which can be assessed with functional brain MRI, so functional imaging studies. The point is that eventually, whatever is, so some people think this is all in your head, meaning that you are pretending to feel tired. Now we have countless studies telling us that this is the infection triggering everything. But eventually, the management may be similar, meaning that my personal approach is trying to have a multidisciplinary and holistic effect. So on one side, to pharmacologically manage problems like tachycardias, viral persistence, or chronic inflammatory responses. On the other hand, supporting mental health is always important, and because your mood can be impaired either by the infection directly, or because your life has changed dramatically since before COVID. And therefore, if your mood is strongly impacted, it's still important to have an experienced neurologist or a mental health doctor to try to teach you how to live with the new self, and to accept the new abilities you can deal with in the short or middle term. Or sometimes if you have an acutely changing mood, it is also okay to accept mental health medications to help you stabilize. The problem is when doctors only send you to the psychiatrist, because the psychiatrist only will not help you in the long term. I think the optimal, if your mental health is severely impaired, is to accept to have a mental health support, but also to have a physical inflammatory support. When we go together, you will see that in the middle term, you will be able to reduce the need of mental health medications, and you can slowly get better.
Thank you. It's a question from an unnamed person. Long COVID is really complicated, and the treatments for different parts of it are difficult to keep track of. Have you got any tips to help young people to manage medications, lifestyle advice, diet, supplements, etc.?
Yes, just to finish one point to the previous question. So how can I tackle with these doctors? You will give them the registration of this video. Maybe this will be helpful for those who don't trust you. So for this other question, yes. So, as I said, this is usually a collaborative effort where we need one doctor trusting you first, your parents trusting you, and nowadays most of the families are supporting their children, your school trusting you, and maybe if you were having other activities, like the sport teacher trusting you. So first, this is a support a team who we need to be supportive with the patient from several different perspectives. Meaning that, myself as a doctor, I do multiple tests for testing the mental health, the heart, the physical functioning, the autoimmunity, and so on. So we explain why these medications are useful, and we try to make the patient, even if a young patient, actively engaged in why some medications are importantly. Secondly, we explain why, particularly at the beginning of this process, patients need to learn how to do pacing, how to not do too much, but also not doing nothing. So trying a balance, a personalized balance. But we have to discuss with the parents, because the parents need to be actively involved in this process, as well as schoolmates. So when you have all the people daily involved in the daily life of the patients, it is easier to make the child accepting the medications and facilitating the recovery and the acceptance of having the medications.
Thank you. Have you noticed a link between long COVID, autism, and neurodivergence? And that's from Phoebe.
So in some cases, I have to say, so I know that in the UK, someone has found a strong link between neurodivergence and long COVID, and autism and long COVID. I have to say that in my setting, more than 95% of patients I have seen with long COVID were perfectly healthy with no autism, no neurodivergence, nor they have developed that. Just I remember maybe 2 or 3 of more than 300 patients that have had this kind of neurodivergence divergence signature. But this can be for 2 reasons. Usually patients that are being followed up for autism or other neurodivergent conditions maybe were, even before COVID, followed up by neurologists, and they may have never thought about long COVID and sending a patient to me. So I may have a bias of selection. So it's possible that only those previously healthy, where it's easier to make a diagnosis of long COVID, are coming to my attention. So my personal answer is no, I don't see this link, but I accept I may be wrong because of this bias of selection.
Thank you. There's a great question also from Clara about why does long COVID affect your finger and toenails, and how can it be treated?
Yeah, so maybe when you say fingers and toenails, you mean like discoloration, temperature changes, like appearance of a reticulate, which is from the blood vessels. So this is one of the commonest reasons, is that like the heart of long COVID is characterized by a so-called dysautonomia. Dysautonomia means that several functions of our body, like pressure, blood pressure, heart rate, gastrointestinal function, like the tones of your peripheral vessels, are coordinated by a part of your brain, which is called autonomic nervous systems, which is not rationally controlled by yourself. And within this autonomic nervous system, you have the sympathetic and parasympathetic roots, which create a balance in the functions I mentioned you. Like when you are under stress, there is one part of your sympathetic nervous system that make you like fast or be super reactive. While when you need to rest, there is a part of your central nervous system that make your body relax, rest and relax. So when you have this post-viral illnesses, you have dysautonomia, meaning that sympathetic and parasympathetic part of your body are not well regulated, and one part can predominate, can win over the others. And this makes you have like postural orthostatic tachycardia syndrome, meaning that your heart, the blood does not return properly to your heart and can kind of keep resting in the extremities of your body, or the peripheral innervations of your fingers can be impaired because of this imbalance. But also, we know this is well documented in long COVID, there is a persistent inflammation of the small vessels of your body, and this can also contribute with these signs you see on your fingers and toes.
Thank you. Hope that's helpful, Clara. There's a good question here also that says, why do some doctors not believe what we are telling them?
Yeah, this is a mystery to me as well. I've even written a book of that, so I don't want to advertise myself, but just so I will not tell the name. But I've done that because you as a patient were not or are still not trusted by several doctors. But even myself as a doctor, I sometimes I'm not trusted by my colleagues when I tell, this guy can have long COVID. This was very, very, very common at the beginning of 2020, 2021, when actually everyone was thinking that child was tired because of lockdowns. And I was saying, some children were happy during the lockdown because they didn't like school, for example, and now are super tired, and probably is the infection. So I have received the same gaslight you have received from a different perspective, of course. And this is a bias, a mental bias of doctors, which exists since more than 2,000 years. So since 2,000 years ago in the ancient Rome or in the ancient Greece, when people have a disease and doctors were not able to find a reason, they were saying, okay, you are crazy. So I don't know how to translate in English the word of those institutions where crazy people were sent centuries ago, but or like if maybe some of you have heard this word, you are hysteric. I don't know if any of you have heard the word hysteric. So the word hysteric comes from an Latin word, which means the uterus, which is an organ, a female organ. So doctors when we're not able to find a response, like thousands of years ago, were telling their patients, you are hysteric, because this was commoner in women, because you have this female organ, and so you have a predisposition to get crazy. And still nowadays, doctors, when they don't have a solution, don't accept that in medicine we don't know everything, they say, okay, you are crazy, it's in your head, you are hysteric. But my approach is that, when we don't know, I'm not saying I know the reasons, but when we don't know, I'm open to all the solutions or to all the hypotheses. And therefore, for me, it was easier to see some patients that were perfectly healthy and happy before COVID, and then suddenly in 2 weeks, they were not able to do nothing. In my opinion, and this was happening also when lockdowns were not implemented anymore, but people still nowadays in 2025 think it's because of lockdown. So if you tell me why some doctors don't trust you, there is not a rational hypothesis. It is a cognitive bias, and it's a limitation of them. This is my conclusion nowadays. And this is why I would tell you, let them see this book, the video, sorry, or read, because now long COVID is one of the most studied diseases in the history of medicine now.
Thank you. So it sounds like what you're saying is take the doctors, the evidence that's around. We're going to put a link to the book in the chat. So there's a question here. It says, why was I 95% recovered for a year and then totally relapsed?
Yeah, in my opinion, the most reasonable explanation is that you either had a new encounter or with COVID or with another virus. We know that patients with long COVID have and in general, those with post-viral chronic fatigue syndromes, like even post-mononucleosis, post-cytomegalovirus, as I mentioned before in response to another question, many people have a specific susceptibility in triggering chronic events following infection, and this is independent from the severity of the viral infection. Particularly in winter, multiple viruses circulate around, and I think the most reasonable explanation is that a stress event, and most probably a microbiological event, has triggered your relapse.
Thank you. I often get a runny nose and sneezes after a week of working daily to my pacing threshold. Is it a cold or is it post-exertional malaise?
So I would say post-exertional malaise, it's a more complex cohort of signs and symptoms after efforts. I would not say only the runny nose and sneezing. So most probably, I would not classify that as post-exertional malaise. When you have post-exertional malaise, you are really exhausted. You usually are able to not doing nothing rather than resting. So this can be, it's difficult to say what it is, but as the question was, is it post-exertional malaise? I will not classify that as post-exertional malaise.
Thanks, Danilo. How can I persuade my doctor to seriously consider a long COVID diagnosis when I didn't get a positive COVID test?
When I didn't get.
Yeah.
So yeah, so first of all, the clinical presentation, in my opinion, is relatively, many people say it's difficult to diagnose long COVID. In my opinion, it's not that difficult, particularly if you were a previously healthy person doing sport every day, going to school every day, then you have a viral illness, you have extreme fatigue, you are not able to do anymore your daily activities, and you have excluded other reasons for explaining your malaise, like thyroid function, autoimmune diseases, type 1 diabetes, etc. So this clinical syndrome is very easily associated with either long COVID or any post-viral myalgic encephalomyelitis chronic fatigue syndrome. So I will tell your doctor that eventually, even if you don't want to call it, so if this problem started during a peak of COVID circulation, in my opinion, I will call it as long COVID. But eventually, even if your doctor doesn't want to call it as it is, he should at least acknowledge that this is a diagnosis of post-viral chronic fatigue syndrome. In my opinion, and I say this more than often, as nowadays less and less people are testing for COVID, the future scenario will be that long COVID will be less frequent, and we will have a higher number of patients with post-viral chronic fatigue syndromes and myalgic encephalomyelitis, whatever we want to call it. So it's important to have at least a diagnosis of post-viral chronic fatigue syndrome, because within this big chapter, then we can decide if long COVID has some peculiarities compared with other post-viral syndromes. But at least it's important to have a recognized diagnosis, because I hope one day we will have treatments, we will have a formal code, we will have even insurance or health policies to support those patients who are not able to recover.
Thank you. There's a question about sleep. What medical and non-medical things can I do to help me sleep?
Yeah, so unrestorative sleep is one of the issues we usually. So as I said, we tackle with a multiple number of medications, because as our body, all systems in our body are actively related, interconnected. You usually don't solve a problem with only a medication. So let's say that maybe I would have prescribed, I don't know, ivabradine for POTS, gabapentin for pain and mood impact. I would also consider a relatively higher dose of melatonin plus daily habits and good sleep hygiene. So all the things together may help you sleep better, maybe even antihistamines as well.
Yeah, thank you. How is ME/CFS different to long COVID?
Yeah, this is somehow in line with my previous answer. So in my opinion, they are part of the same umbrella. And so we know from the literature that endothelial dysfunction, dysautonomia, pains, mitochondrial dysfunctions are all demonstrated. Brain hypometabolism are all demonstrated both in post-viral chronic fatigue syndromes and long COVID. So mostly the diseases, in my opinion, eventually fell under the same disease category. It's possible that maybe those with long COVID may have a particular phenotype with maybe more clear endothelial involvement, particularly for those who develop long COVID during the early variants. But as I said before, people test less and less, so eventually, in my opinion, in 5 years, they will become the same diagnosis. So in daily practice, so this we may have differences for research purposes, but in daily practice, and this is also what I'm doing today, I consider them and I manage them in the same way, because it's not ethical like to provide 1,000 options for long COVID and 0 for other post-viral chronic CFS.
Thank you. There's a question here from Janine that says, is it worth looking for co-infection, viral, bacterial, parasite, fungal? How would you go about this?
So I know there are some doctors looking at that. In my opinion, I don't see a strong rationale, particularly for fungal and parasitic infections. So there are some authors who are researching the particularly in the United States and in particular at Yale University, Professor Akiko Iwasaki, who are researching how a trigger like long COVID can favor the reactivation of some herpes viruses like Epstein-Barr virus and cytomegalovirus. But other than that, I would not see a major role for other bacterial or parasites. I know that particularly in Northern Europe, there is maybe a more problematic situation with Lyme disease, which in some centers are also being linked with chronic fatigue syndrome. But I have to confess that as in Italy, this is a very rare disease. I didn't have to deal with this confounding factor. So in my opinion, this does not need to be tested out of research purposes, because false positive or difficult to interpret results are very common and can only make things confusing or make you take more and more useless medications. So out of a research test, I do not suggest to routinely use these diagnostics for multiple pathogens.
Thank you. There's a question here from L, age 15. Do you treat with IVIG? I've seen someone on TikTok from America who was really poorly and is now completely better. We cannot get this in the UK. Thank you.
I didn't understand what was the medication.
IVIG?
IVIG, intravenous immunoglobulins. Yes. So yes, I use that. So in general, I go with a step-by-step approach from the most easier to the most complex medication. And when I say complex, I mean both in terms of costs, economical costs, but also possible side effects. So yes, in those cases who are severely impaired in daily life and are not improving, let's say with ivabradine, gabapentin, and all other options, I do yes consider off-label indications of IVIG. Again, here not all patients recover. So ideally, we one day should have a test maybe to recognize those patients who have a particularly high autoimmunity, which can benefit from IVIG. But as these tests are not available, in the most severe cases, I try empirically, and if the patient improves, I go with monthly infusions.
Thank you. So we've got people participating from all different countries in the world today. So there's going to be different opportunities in different countries. So thank you everybody for asking the questions and letting us know which country you're from. It's really helpful. There's a question in the chat from Zeke that says, I was at a store yesterday and I was feeling good, but when I got back to my house, I crashed for the rest of the day. Why?
Yeah, and probably you have had the so-called post-accessional malaise, which is the kind of the heart of the cornerstone of this condition. This means that, so let's say when you were healthy, or when, like myself, if I play a football game, maybe I rest 2 hours and I'm okay. Patients with long COVID and other post-viral fatigue syndromes are not able to recover and to restore the energetic background as before this activity. So most probably, you have probably worked too much, you have reached a too high level of tachycardia, your metabolic stress was too high, and this triggered the post-accessional malaise. So this is in line with my first answer, maybe. You should learn how, maybe doing a diary, you should learn to know those activities which you are able to do without crashing as you did yesterday. So maybe if you were out, let's say 6 hours, and you can track on your iPhone, you walked 10 kilometers and you felt that bad in the evening, it's the next time try to work 2 hours less and 2 kilometers less, and you see if you crash or not. If you crash, the next time you go less. Okay, try to. So the idea will be to try a balance, because even doing nothing at all, seeing no one, is also bad for your body and mental health. So with patience, with a diary or other tools, you can learn that level of activity who can help you in having friends, going to school, but without feeling bad.
Thank you. That's really useful advice. And I know from my own experience of post-exertional malaise that I've had really good success with mobility aids. So I wasn't able to socialize at all, but using an electric wheelchair now, I am able to improve my experiences outside of the house. So I think talking to an occupational therapist about different aids that might be useful can also be a really good way of managing post-exertional malaise. There's a question.
Exactly. I entirely agree with that. If you see that even small amounts of meters trigger you for sexual malaise, please don't be shy about using any aid, because you can have a normal life, you can go out with friends or whatever using it. Because even if you stay the whole time at home because maybe you are shy of using an aid, it's also bad for you. So I strongly suggest you to be open minded. We are in 2025, so we cannot be shy anymore about being special compared to, each of us is a different person.
Yeah, that's so true. And actually, we might run a further session on this because I think it's a really great topic to think about. There's an interesting question in the chat from Sky that says, is it possible to infuse healthy people's cells? Since cells repopulate, would one healthy cell be able to cure our damaged cells?
So from a scientific perspective, so this question is like a question that a great scientist can do. So in science, any hypothesis is welcome and any question is welcome. So this is possibly really a potential useful effect. The point, so sometimes even in some diseases, bone marrow transplantations have helped, like in HIV or in other conditions. So hypothetically, this is feasible, but of course, this is a very invasive procedure, and this will need to be studied within specific settings, like first in experimental models, like we have animal models of long COVID. Then if you succeed in animal models, you can try to make some small studies in humans and so on, and then in children. The main point is that if people, when you said many times, if most people don't trust long COVID, and most doctors don't trust long COVID, most policymakers don't trust long COVID, and most funding agencies don't trust long COVID. Eventually, the funds donated to do this type of research are less and less. This is why we need to talk about long COVID, because ideas like the brilliant idea from Sky can only be studied and tested if we have actually lots of money to prove or disprove this question. So I say this is a very interesting hypothesis, but need to be tested. We don't know.
Thank you. This is a super interesting question. Clara's sent some really good ones in. She says, can long COVID affect people's personalities and why?
Yes, this is indeed many people. This is both patients themselves, but sometimes friends or parents or partners told me my child's boyfriend, girlfriend completely changed since COVID. Yes, we have changes in mood, in personalities, in characters, and this is because now we clearly know that something is happening at a cellular level, even within our brains. Even if you think people, let's say doctors don't trust long COVID and like the mood disorders associated with long COVID, but everyone trusted that people lost their smell and taste due to COVID. This is accepted by everyone in the world. But when people lost their smell or taste because of COVID, the smell is not inside our nose. We smell odors and we taste foods because our brain codify the smells and the tastes. So even from the smell problems, we know that something is happened within those parts of our brains which codify the smells and tastes. And we know that chronic inflammatory changes, microglia changes are happening in specific areas of our brain. If this happens in the areas who codify our taste, we lost the taste. But if this happens in areas who codifies our emotions or our mood and emotions will change, and our personalities as well.
Thank you. There's a question about vaccination from Karen. Is it okay to have new vaccinations? Will the body take it as a new illness, bad, or as a help?
Yeah. So this is another bingo question. So as I said before, avoiding infection, in my opinion, is extremely important to prevent relapses, because people with long COVID, when get a new COVID infection, they feel worse. So one would say, okay, let's get the vaccination then. But unfortunately, like here we are like 50 and 50%. There are some patients who get the vaccination and get worse, particularly if it's an mRNA vaccination, and some people who actually even felt better. So it's really, really a bingo. And I'm tackling, so usually I don't suggest routinely to patients with long COVID to get mRNA vaccination. So I either suggest talk with your school about using their filters, treat COVID if you have a new COVID infection. So get an early treatment, either Paxlovid or metformin, because we have the trials showing less long COVID when you get these medications. Or third, just today, I had a meeting with a company which is producing new monoclonal antibodies, long-acting, which covers immunocompromised patients for 6 months. And I begged them to found some studies for injecting these monoclonal antibodies to patients to prevent new COVID infection, which hopefully can also improve long COVID itself. So and fourth options is to use, but these vaccines are not yet very much licensed in our countries, to use no mRNA vaccines who produce the spike proteins, but the other vaccines who are based on traditional technologies. So it's a person by person discussion.
Thank you for helping us understand that better, Danilo. There's a question here from Kadeen, who is 10 years old, from Holland, and says, how is it possible I have a lot of brain fog and not everybody has that? I was very smart and these days I feel so dumb.
Yeah, so I would say that nowadays, unfortunately, millions of people have brain fog. So I know this will not cure your brain fog, but you are definitely not alone. So it's not something unusual for you. So probably the reasons for brain fog is the neuroinflammation I've mentioned before. And this, of course, can impact your daily skills. Or you can manage them in 2 ways. First of all, for example, if you go to school, your school need to partner with you, allows you like scheduled examination with lots of time in advance. Like you only need to be interviewed by your teachers in a predefined day, like 3 or 6 months apart, because you struggle more compared to before to learn things. And also like pacing yourself, as I did before, because every time you trigger post-exertional malaise, I believe your general condition worse. So pace, plan things with your family, friends, and teachers, and be confident, because I have the feeling that some new medications, hopefully like even low-dose rapamycin or some antiviral protocols, may help in improving your brain fog one day.
Thank you. And they've put in the chat that they can't go to school because of this anymore, and they really want to. So thank you for sharing that question. Kadina, thank you for the answer, Danilo. So we've got time.
And I open a bracket on that, because sometimes, exactly, people cannot go to school anymore because of these reasons. But even because teachers sometimes are not very collaborative, and they don't accept to not make questions to you. So what happens? People don't feel smart. So people get tired more, and it's okay. But sometimes even people are scared or of behaving in a strange way in front of other friends when they receive unexpected questions. So sometimes if you have a strong partnerships with your teachers, you don't get the questions, you are allowed to go 1 or 2 hours. This helps you a lot and can maybe get gain you a few hours of social interactions in your life.
Thank you. We're just coming up to 5 minutes before the end of the session, and I've got two questions left for you, Danilo, before we'll wind up. So there's one question here from Wanda that says, is it dangerous to work out if I have side effects like fever, fatigue, and rashes?
Well, no, I suggest to, when you have these symptoms, to rest and not work out. Yes, resting is an important part of this disease.
Yes, I completely agree with that. There's one last question we're going to finish on, which is, where has it gone? Which is, I've lost it. Oh, goodness me. Thank you. Why do we often see multiple cases of long COVID in the same family? Is there a role of genetics in the development of post-viral illness, do you think?
Yes, some studies are already providing some clues about a genetic predisposition. And my personal thought is that, yeah, 100%, 99% there is a genetic predisposition, because eventually, even if we have millions of people suffering for long COVID, this is still a relatively small part compared to the billions of people who get COVID, because everyone has had COVID at least once. So for sure, there is some predisposition on how we interact with pathogens for developing the disease. And therefore, I also have many patients, many families with multiple long COVID cases within the family. So definitely, yes.
Thank you. And there's a comment from Zeke in the chat to say that that Zeke and their mum have long COVID. And I know that myself and my daughter both have long COVID. I actually found the question that I really wanted to finish on, which is, are there things a child or teen who has long COVID can do to give themselves the best chance of improving? And I think you touched on it earlier.
Yeah, so it's multiple things. So first of all, fight for your rights. So if you really have doctors who don't trust you at all, like, change doctors, but still keep fighting for awareness of your condition. Don't be shy about talking about your disease, because there are many others who probably either don't know or have the same disease but are too shy to tell the world. Secondly, do the daily activities about, pacing, learning your threshold levels, talk with your families, actively engage your school and the other friends. Don't be shy to use daily aids like electric wheelchairs. And if studies start in your region or country, consider participate with the clinical trials. So yeah, it's a summary of doing everything we said this hour.
Perfect. Thank you. I think that's a great point to end on. I'd just like to thank everybody for their questions today. I'm sorry if we haven't got through all of them. We have prioritized the questions from children and young people. We are thinking about doing a second session, perhaps next month, maybe from to include some of these questions that we haven't reached today, but we'll share more details on that at a later date. And Danilo, would you just like to share where people can find more information about your work and stay in contact with you?
Yes, for sure. I have a blog where I publish free contents every Sunday, which is called Buonsenso and the Kids. Buonsenso is my surname. So it's not a very fancy name, just Buonsenso and the Kids. I think if you Google it, you will find it. So there is a chat, you can email me, you can read the news on the literature. We also do similar events. So yes, maybe over there it's the easiest way.
Thank you. And thanks to everyone for joining. If you have any questions afterwards about today's session, please do email info@longcovidkids.org and we will try to address as many as we possibly can. And just a reminder that it's Long COVID Awareness Day coming up on the 15th. If you would like to wear your support, we dropped a link in the chat to where we're selling some badges that you can wear to support the community and the charity and help us keep doing work like this. Thank you so much, everyone.
Bye-bye. Thank you very much. It was very difficult, but very funny.
You did a great job.
Yeah, thanks, Danilo.